I want to shift our focus, to the other worrying development that we're reporting today, which is a COVID scare in schools. Now, children have tested positive in Himachal Pradesh, Punjab and Haryana. In Himachal Pradesh, so much so that after 62 children tested positive, schools that were reopened on the 2nd of August have once again been shut down. As far as Punjab is concerned, we know that around 33 children have tested positive in Punjab, and what we're also learning is that over 20 of these cases are being linked to 2 schools in Ludhiana. Now, before we get into the specifics of what really this means, I want to just ask both our expert panelists, what do you think, Dr. Trikha, first to you, needs to be done in order to ensure that children are better protected? Because, the inevitability of schools reopening is something that we've talked about. Whether schools should reopen or not is a separate question. But parents who are sending their children to school, what do they need to keep in mind? What are the basics that they need to keep in mind?
Rishika, the bottom line is that the schools have to open.
Yes.
The second thing is the schools have to be opened in a graded manner. We can't do it at the same time as everything opens up. The third thing is it's the responsibility of both the school and the parents to see to it that the basic COVID culture is followed. As far as the school is concerned, it has to be ensured that all people working in the school, the teachers, the principals, the ayas, the mates, the people who look after younger children, the sweepers, everybody, the PT teachers, they all have to be vaccinated, and they have to be made aware of the fact that if they are not feeling well, if they have some symptoms, flu-like symptoms, they are not going to report to school. They have to be assured that if you have symptoms and you don't report to school, your salaries will be protected, so that anybody who is a carrier or who has a mild disease in spite of both the jabs does not land up in school. Similarly, the parents have to ensure that the children are basically taught some kind of COVID behavior.
Right.
It's tough to teach children. They will share their bottle of waters. They will share their lunch boxes, and it's fun to do that. You have done it and I have done it. But this has to be told to children not to do it. They have to be told to be wearing their masks. It's going to be tough to teach to children, but the schools can take care of things at their own end.
Right. Dr. Mahesh, how are you looking at these developments? Because one doesn't, unfortunately, for these 3 states, and I want to put that out as well, whether it's Punjab, Himachal or Haryana, we don't know how many children were being infected when schools were closed. That data is not there. This is just data that is coming out at the moment after schools have reopened. The question many are asking is, should at least the staff, the eligible population, be compulsorily fully vaccinated before reopening schools? We know there's no vaccine for those under 18 in India yet.
Of course, that is the top priority, especially the staff, teachers, and the helpers and drivers of the school buses, etc. They have to be completely vaccinated, no doubt about it. Apart from that, if even after completing their vaccination, even if they come in contact with a COVID-19 positive confirmed case, they have to report it to their authorities, and I think they again have to be tested after 3 to 5 days of that contact, and to see whether they have been positive, because
yes,
even they may not get a severe disease since they have been vaccinated, but still they can transmit the infection to the kids who are vulnerable and not vaccinated yet.
Right.
Though COVID-19 outbreaks have occurred in school settings, multiple studies have shown that the transmission rates within school settings, when multiple prevention strategies are in place, are typically lower than or similar to the community transmission.
Yes.
And that is why it is very important to apply the layered manner of prevention. Maybe it is again masking, distancing.
No,
and
I want to just also ask Dr. Trikha very briefly. Dr. Trikha, there are many parents who are apprehensive of making younger children wear masks, and we know in Haryana, for instance, even primary schools have opened. What should be the mask protocol when it comes to children?
See, the mask, there are no guidelines which are different to mask protocols as far as children are concerned. We've got to tell them that they have to be told why are they wearing a mask. They have to be told when they are near a child, when somebody is having a running nose, it's better to wear a mask.
Right.
They have to be told they've got to wash their hands. You know, a child has to be told not to be touching things and putting the finger in the nose or the ear or the eyes. These small little things which were taught to us when I was in school in moral science classes have to be coming back to us.
All right.
Somehow we have forgotten it, right? Moral science and these kind of behaviors become important.
All right. Well, there is a whole new normal that children need to adapt to in order for schools to be safely open. I mean, look at what's happening in Himachal. After over 60 children tested positive once schools reopened, in about 12 days' time, schools have shut down once again. One sincerely hopes that that's not the story that unfolds in several other states. Thank you both very much for joining us on these extremely important topics. Thanks once again for being with us.